Hi everyone, so we're going to get started for today. Thank you for your patience while we get ourselves set up today. But welcome to our Elder Abuse Recognition and Response in Older Adult Clients webinar. My name is Jo Collins and I'm an Injury Prevention Coordinator here at Injury Matters. So before I get started, I would like to acknowledge the traditional owners of the land in which I present from today, the Whadjuk Noongar peoples, and extend my acknowledgement to the traditional owners of the lands in which people from across the state are attending today as well, and pay our respects to the elders past, present and emerging. So a few little housekeeping points before we get started. Can everyone please just double check that their microphones are muted? This will allow that we can hear the presenter clearly. We'd also love to hear your questions, so I strongly encourage you to please send them through via the chat and we'll go through them at the end of the presentation. If you've got more than one person in the room with you listening into today's webinar, we'd appreciate it if you could also send us a quick private message via the chat tab and let us know how many people are listening in with you. And if you face any tech issues during the presentation, please reach out to us in the chat tab as well, and we'll do our best to assist you there as well. And I also want to let you know that today's webinar will be recorded and we'll pop it onto our No Injury website following the webinar. So just a quick overview of what we're going to cover in today's webinar. So we're going to have a look at elder abuse in WA and the impact that that can have on older adults. We're going to learn how to recognise and respond to elder abuse. We'll explore what some of the options are that are there for your clients who might be experiencing elder abuse. And we'll also have a look at who Advocare are and how they can assist you moving forward. So a little bit about Injury Matters. We're for safer people and places. And Injury Matters aims to prevent and reduce the impact of injury within the WA community. And we do this through advocating and providing education for injury prevention, as well as providing support for people that have been impacted by injury. So today's webinar is delivered through our No Injury program with the support of the WA Department of Health. And No Injury is a statewide program that aims to enhance the capacity of injury prevention and safety promotion practitioners to deliver quality injury prevention activities. Via the No Injury program, we provide training events such as today's webinar, resources and networking opportunities to support the injury prevention across the sector. And given the diversity of injury in WA, the No Injury program involves a variety of injury topics. However, today we're going to be focusing on the topic of elder abuse. So elder abuse is defined by the World Health Organization as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. And in WA, elder abuse is estimated to affect 1 in 20 older adults. It can take many forms, including financial, social, physical, sexual, psychological and emotional abuse, and it can occur in a range of different settings. Elder abuse can have ongoing health impacts on an individual, such as physical injury, poor mental health, and increased risk of placement in residential aged care. And as with many forms of abuse, it can be difficult for an individual experiencing elder abuse to speak out. So it's vital that we as health and community professionals that work with older adults in WA carry the skills to recognise and respond to elder abuse to ensure the safety of their clients. So to continue this discussion, I'd now like to introduce you to Naomi Jackway from Advocare. Advocare is an independent, community-based, not-for-profit organisation supporting and protecting the rights of older people in WA through information, advocacy and education. So welcome, Naomi. I'm just going to bring your slides up.
Thank you everybody for having me today. So as it was quite rightly said, I'm here today to talk about elder abuse and Advocare and what we can do. You know, we'll be talking about recognising, preventing and responding to abuse of an older person. So who are Advocare is what we are going to cover, as well as recognising abuse, preventing abuse and responding to abuse. So Advocare provide lots of services, including advocacy, information, education. We also man the WA Elder Abuse Helpline and volunteering. So advocacy is walking alongside the older person. We have time to listen to them, what they would like, and we will be able to provide them with options to assist them. We provide them with information about their rights and access to aged care services. And we also go around WA, from the far north to the deep south and everywhere in between, providing education and raising awareness of the services that we provide, and also of the Elder Abuse Helpline. So the Elder Abuse Helpline is completely free, as are all of Advocare services, and it is completely confidential. One thing that we also have as well is volunteering, and we actually are able to provide volunteers to people that are receiving services for home care packages or any services at home or in a residential facility, where they may be able to connect with an individual such as a volunteer. So as an advocate, we provide free, confidential, client-directed service. It's information, and we discuss options with a person. And an advocate may also provide information with service providers and professionals, but we will always be client-directed. We also make referrals to other agencies, and these agencies can be legal aid, it can be the Older Persons Rights Service, and we work quite closely with a lot of other agencies for the best outcome for the client. So does anyone have any questions around who Advocare are and what we do? Or are you happy for me to continue to go into a little bit further discussion around elder abuse? No questions? Okay, I will continue. So as mentioned earlier, elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. Now, one of the most important words there is actually trust. Okay, it can be a single repeated or act or lack of appropriate action, but it must be where there is an expectation of trust. And that can be with a family member, a health professional, but someone that a person is in that power of trust. So the elder abuse facts. So based on the 2018-19, financial abuse is still our highest reported, and I want to really stress that this is only based on what is reported information. So financial abuse is currently sitting at around 595, psychological 580, social, neglect, physical and sexual. We still believe that elder abuse is probably one of the most underreported forms that is happening. So what increases that risk of vulnerability to abuse, and what can be done to minimize it? So some of the things that increase the vulnerability for people open to abuse is dependency, medication or mismanagement of medications, family dynamics and living arrangements, social isolation, that disconnection from the community, language and cultural barriers, health and cognitive impairment, technology, depression and grief, and lack of knowledge. And these are just some of the things that might be deemed to make a person vulnerable. Barriers to asking for help can be fear, think that nobody will believe them, ashamed or embarrassed. People blame themselves. It's not culturally appropriate. People are socially isolated. They're not actually able to call. They're not actually able to speak. They're not aware of their own rights or services, or they choose not to. So at Advocare, one of the things that we do is we note that it is very important when somebody calls the Elder Abuse Helpline to answer that call as soon as possible, and ideally within 3 rings, because we acknowledge the courage that it takes somebody to call that number. It is vital that that call gets answered, and it gets answered directly by an advocate. So it doesn't go to a reception or to anybody else. It is answered directly by an advocate, and an advocate will listen and they will respond accordingly. Oops. So responding to elder abuse. So here's a case study, and this has been de-identified, but we had a client, her name, we'll call her for the case study Mary. She was a 92-year-old lady living in a retirement village. She's still quite independent and has a strong social network in the retirement village. The village is located near an area where she lived most of her life, and so she has strong local connections. She has 2 adult children living nearby. Mary received some basic support with domestic assistance through her CHSP, which is the Commonwealth Home Support Programme provider. Her son provides assistance with shopping as she can no longer drive. Mary has undertaken sound financial planning and frugal spending to ensure she has funds in her bank to get things she may need as her situation changed. She provided her son with a key card to her account to help with the shopping if she was unable to go, and had indicated to him that he was able to get a few things if needed while shopping. While returning from the shops, her son made some statements that gave her cause for concern and led her to check her bank accounts, only to find that she was missing over $30,000. With the support of a friend, she went to the police and informed them of the theft. In the middle of the night, while Mary was sleeping, her son let himself into her unit, tore her sleep apnea mask off her face, and threatened her, leaving her terrorized and extremely frightened. So from this, we can actually see that there are a number of things that are occurring. And what we find is where someone is actually experiencing abuse, they are experiencing more than one type of abuse. And in this situation, we would say that Mary is experiencing financial abuse because he has taken that money, the $30,000, from her account without her permission. Ripping her sleep apnea machine off her face is physical abuse, and it could potentially have injured her. And that's psychological abuse, informing her that if she didn't need the money because she was old, creating fear, emotionally and physically, verbal abuse and threats. So what we see in that case there is that there is more than one type of abuse, and that often occurs. So what do? Well, we actually, once a person contacts the Advocare Elder Abuse Helpline, we provide that emotional support and validation. We listen. We ensure that the person is safe at the moment of call. We assure them of their rights and options that they have available to them. We put supports in place with their permission and their consent. If a person chooses not to do anything, we have to respect that right. But if they choose to do something and they would like that support, we will help put supports in place. And those supports could be anything from a volunteer attending to formal services, to perhaps providing a little bit of reprieve by going for residential respite or cottage respite. And that will give the person time to think about what they would like to do. We would also perhaps put them in contact with the lawyers at Legal Aid or the Older Persons' Rights Service to make sure that they have everything in place as well. And that can be a restraining order, it can be making sure that their enduring power of attorney is what they would like it to be, and their enduring power of guardianship. But we also discuss other family supports that may be available and the long-term consequences around their emotional well-being, their health, and their living arrangements. And they're just some of the things that we will speak to people about, because what we acknowledge is each person that calls has individual circumstances for that call, and we will tailor each call and each response to that person and how we can help them, because we are a client-directed service. We will only do support with their help and their consent. So the elder abuse protocols is something that was created for professionals and for organisations. And what this does is it actually provides guidelines for action and actually introduces a 5-step approach. It has key concepts for consideration and also talks about signs of elder abuse, risk factors, and referral and support agencies. So what is the 5-step approach? So the first thing that we say is identify whether abuse is taking place. Ask questions to find out further information. Has anybody hurt you? Are you frightened of anyone? Or if it's an emergency or the person is not in a safe situation, call 000. Provide emotional support. Listen to the person, acknowledge what they are saying, and validate their feelings. Assess risk and plan for safety. Determine the level of urgency. If it is urgent or the person is not in a safe place, call 000. Follow your agency procedures if you have them, including information to line managers. Take steps to safeguard the older person, and often in the response of any abuse, we would always say document everything. Even if the person does not want any assistance, do document what is occurring. Refer. Make referrals, get them to speak to somebody. If they're not happy to speak to somebody on their own, perhaps facilitate a call. It can be, with the client's consent, a call facilitated to Advocare. And we will also provide them then with the options that they have available. Contact appropriate services that may be available to them, assess that risk, seek consent if it's not an emergency. Without the older person's consent, there is very little that can be done, because an older person has the right to choose what they would like. If they choose to refuse any assistance, safely provide them with contact information for services in case they wish to get in contact at a later date. We sometimes experience people calling the elder abuse helpline on a number of occasions, but it only takes that one call for them to decide that they would like to change that situation, and that is where we are there to help. As I said before, document. Record any concerns of any action and any actions taken. If the older person has capacity and refuses the assistance that you're offering, document it and detail it. It is their choice. So how would you use the 5-step approach? Another case that has occurred that again has been de-identified, but for the sake of this talk, we are calling the person Bill, is an 86-year-old grandfather of 2. When Bill's wife passed away, he became forgetful and a little disorientated, confused and depressed. Bill didn't really want to move away from his friends in regional WA, but his daughter Sally persuaded him to sell his house, transfer the money to her bank, and move in with their family. And we're actually seeing this more and more. And it's not just a case of moving in. We're also seeing that they are telling parents that they're telling their children that they will build a granny flat, or they will move in with them and they will look after them. And in this situation, Sally said that they could both benefit from this course of action. So Bill sold his house and transferred $250,000 in exchange for his care. There was no formal record of this arrangement, and Sally also held the enduring power of attorney for Bill. Everything was fine until Sally used the money to take her family on holidays, leaving Bill home alone, unable to buy his diabetes medication or go to the shops. On her return, Sally began verbally berating Bill and refused to give him back the money when he asked for it, claiming it was a gift, and she evicted Bill from the house, leaving him homeless and without any support in an unfamiliar environment. So based on that, the 5-step approach would be listening, would be acknowledging to see if Bill is currently safe. We would also then hopefully be able to make referrals for services for him. One of the services that people aren't aware of at the moment is what is called the Commonwealth Home Support Aged Care Homelessness or Risk of Homelessness Programme. And so with our advocates and the specialties of navigating the aged care system, we can help people provide new housing or accommodation by getting this code and referring it to a provider. Bill has also experienced financial abuse there because his house is sold and Sally has used the money. He's also been neglected. Bill was unable to buy his diabetes medication, go to the shops, and was left homeless. His social connections from his regional WA area have unfortunately been disappeared because he has moved to a place that is not in his community, and the psychological abuse that he has also been subjected to. And so I have just seen a question, so I will just see if that question can be answered. Just bear with me one moment. So so someone has asked that that inpatients are at risk of domestic violence are going to be screened and offered assistance. There'll be specific form we will need to complete in the same for elder. Is this the same for elder abuse? So with regards to elder abuse, at this moment in time, there is currently no reporting line. Okay, and that means that in relation to somebody wanting to report and investigate an allegation of abuse, there is nothing that can be reported to other than the police, if the person would like to, because the person actually has capacity. If a person does not have that capacity, so they no longer have legal decision-making capacity, which would be determined by a geriatrician, then that matter can be taken further, either through the State Administrative Tribunal or through the Office of the Public Advocate. And the Office of the Public Advocate can investigate to see whether or not the person that is responsible for somebody that no longer has capacity is acting in their best interest. We can also provide free flyers and posters around elder abuse. I have got some on the table if you can see them today, and you can certainly contact Advocare for them. So, organisational responsibilities. So as an individual, we have responsibilities, and we can also say things if we see things. If we're unsure, we can contact people such as Advocare to find out what assistance we can offer. But as an organisation, there is actually policies that should be put in place as well that we recommend. And that is developing an elder abuse policies and procedures manual. Ensure that all the staff are aware of any processes, including internal reporting mechanisms. Making sure that everybody who comes into contact with an older person is aware of what is available for that older person. And if they're not aware, where they can go for that information. Arrange staff training around elder abuse and policies that you have. And I can't stress it enough, document, document, document. If you are ever unsure or you are unaware of how to help somebody, always call the Elder Abuse Helpline. We are there to provide with assistance. And we are there to provide you with assistance, but also provide you with options that that person may have available to them. We wouldn't be able to take action unless we were speaking to the person directly. So what is an organisational policy? What are your internal steps? Do you have any? If not, it is worth speaking to your organisation policy manager or speaking as an organisation on what you would like to do. Okay, so find someone that you can have a talk to and look at seeing if it's something that you could look at implementing. And we're more than happy to send the elder abuse protocols to anybody that would like them. So responding to elder abuse, what is it that we do? As I said before, engage and listen. Know the protocol for responding to elder abuse. If you're with an organisation, follow your organisational policy. And if you're ever in doubt, speak out and refer to the elder abuse helpline. And I've got the number there, and I'm just going to leave it there for a minute if anyone would like to take that number down. So again, if in doubt, speak out. Okay, try to get people to call the elder abuse helpline if you feel that they may be experiencing elder abuse, or facilitate a call with the person's consent. So how can rights be protected? How can someone try to prevent themselves being abused? So things such as enduring power of attorney, which is around financial matters, enduring power of guardianship, advanced health directives, a will, a family agreement, and stay connected to the community. These are all really powerful documents, so care must really be taken when considering these options. If a person still has decision-making capacity and they would like to change their enduring power of attorney and guardian, they certainly can do so. If a person no longer has capacity and the guardian or attorney are not acting in their best interest, then steps can be taken for an investigation through the Office of the Public Advocate or through the State Administrative Tribunal. When considering what and who to fill in the enduring power of attorney and the power of guardianship, we do recommend having some conversations around not only who you would like to put in now, but also whether that would still be the case should things happen 5 years or 10 years down the line. It is always important to make sure that you are aware of the documents that you are signing. If someone is not aware, then they are not informed, and that can cause elder abuse. Does anyone have any questions? I think I've answered the two that were there, so I will continue. So what we would like you to do, if you're happy to do so today, is we would like you to go to our SurveyMonkey website and provide any feedback around our presentation and what you may like to see it involve in the future. Okay. And that is, I'll just leave that up there for a little bit of time. And what we would say is if you do need anything or you have any questions, do feel free to call us, okay? One of the things that I spoke about earlier is staying connected to the community. And we do that and we help people do that by getting services in place. Now we do that in My Aged Care. And if anyone has heard of My Aged Care, you may have also heard of the Commonwealth Home Support Programme. And while everyone is just taking down that, I will talk about the Commonwealth Home Support Programme and home care packages. They are available to people in the community. And they are available to people who require some extra services to continue to live in their home. And what will happen is that through Advocare, we can help support somebody through the process of My Aged Care. And that will actually assist with somebody being receiving services at home And that can be whether or not it's someone to go into the home to provide domestic assistance, or someone to go into the home just to provide that little bit of social support and social interaction. We heard stories of people that are actually experiencing loneliness. And so what we actually did is Advocare introduced the community volunteer program. And that is where we're also able, on top of the My Aged Care services, to provide a free volunteer into a person's home. And we're also able to do that into a residential facility. So these are also steps that are available to people to stay connected, to try and ensure that they are trying to minimize their risk of elder abuse. Does anybody have anything more? Any more questions or anything that they would like to know more about? I do apologize. No. Okay, I think that's everything from me today. If you would like any further information or any resources at all, do feel free to contact Advocare, and we're more than happy to provide that information and support and that advocacy service. Thank you for having me today.
All right, thank you for that, Naomi. I'll just double check. Someone's just raised their hand. Penny, do you have a question that you'd like to send through? We've got a few more questions, Naomi, so I might just see if there's any of those that you can respond to.
Certainly. So the first two I have answered, but the third question is around Commonwealth home support. People are stating that in regional areas, especially in the wheat belt, that they have been cancelled. If they have been cancelled or are no longer available in that area, what we would recommend is that we actually go for a home care package for a client. And that means that the services can still be provided, but they would be provided through a home care package. And a home care package does currently have a national wait list, but due to Commonwealth home support programs not being available, through our experts in navigation, our advocates that are experts in navigation, they would actually work with clients to see if they would be eligible for that high priority. And that means that they can actually get a home care package a little bit sooner than someone that is waiting a medium priority. If there are other things that are not in place, then we can certainly work with organisations and individuals to see if there are options, such as potentially restorative care if a person has been in hospital, or if a person is needing the services urgently, it would also be looking at other things that may be available to assist them to stay at home. Commonwealth home support programs are limited, and that is why we do see the limitations in regional areas, and that is something that that Advocare is aware of, and we do work quite remotely, and we do find alternatives to that. As I say, it's currently the preferred method is for that home care package, and we're just trying to get a person onto a home care package. If a provider is not available for a home care package, then we can certainly look at other areas that are available within the guidelines that would allow them to broker out to services in their area. Does that answer the question?
All right, thank you for that, Naomi. So just to wrap up the rest of the webinar, I just want to highlight a few of the key resources that Naomi has talked about today, and these can all be accessed on the Advocare website as well. And so we'll also send out an email with some links to these key resources, as well as that SurveyMonkey evaluation that was up on screen as well. We do have a few upcoming training and events just to wrap up this financial year through the No Injury program. So please feel free to register for any of these if you're interested. We've also got an Injury Prevention Network meeting coming up in August, and that's really a great space for anyone working in the injury prevention space to network with other health professionals in the area and to just share that knowledge around. For anyone that wants to keep the discussion going from today, I also encourage everyone to sign up for our Connected program. So Connected is a simple online registration where every 2 months we will match you up with another injury prevention professional for you to reach out and have a quick catch-up, coffee catch-up, or a quick 15-minute phone call, and just to network with everyone else in the injury prevention space. I do also want to let everyone know that when the webinar closes today, a short evaluation form will pop up on your screen from Injury Matters. We'd really value if everyone could just take a few moments to complete this short survey. It really ensures that we are providing training that meets your needs as well. So I just want to say a huge thank you to Naomi for that webinar. Advocare are clearly a valuable and compassionate service that's out there. All right. Thank you, everyone. Have a great day.